Here. I am Dr. Joe Esposito. Just joining us for the first time. Welcome. Glad you could be here. Oh, got to move something? Got my crew back there. They're moving things around here, so hang on one second. Got to make sure we got everything right. You know, we're doing this on very high-tech cameras here, so there you go. Moving that camera around, making sure I'm plugged in, making sure that's plugged in, making sure everything's working. No, maybe, yes. Okay, got to hang on for a second here, folks. Got to get the cameras working, so. Okay, got power to it. I see power on that camera, so. Is it working? Okay. No. So hang on. Still working. Still checking. Still checking. Glad you could be here, though. If you're on one of the platforms that has a camera, hi. What we do is, and I'll explain, well, I got to wait till the cameras get rolling here, so. Heather's scrambling crazy to try to get it going here. So we make sure we got it. Oops, she's rubbing her face. That worries me. She's confused. So hang on, guys. It's a mystery. It's a mystery. It's a good show today. Got a lot of good stuff to talk about. A lot of good research. I love shows like this. A lot of research, a lot of technical stuff. I get to throw out a lot of big words in this one today. It's going to be on bone health, by the way. It's not just for women, it's for men too. And we're going to talk about how bones are built and why many of us, not us, of course, because we're the top % of the world that takes care of ourselves, why so many people have issues and what else it causes. It's not just bones that we're dealing with a lot of other things involved. And as a chiropractor, of course, and a pain management doctor, I am very concerned about bone health because we want to make sure bones are aligned properly. We also want to make sure that they're healthy. And so we're going to talk about that too. And what to do about it. The most important thing is what to do about it. We got to make sure we discuss the options that are there because many times, in fact, I just saw a patient today, several patients today, about 3 or 4 of them. And I said, you know, my doctor said X, whatever. And I said, well, what did they tell you to do about it? Well, nothing. They just told me what I have. They didn't tell me what to do to fix it. And that's a big issue. Most doctors don't know how to fix things. And I'm not against doctors, believe me. I mean, these are some of the brightest people in the world I've ever met, is they don't know how to fix things. And that's what we're going to talk about is things that you can do to actually fix these problems, not just treat the symptoms, but get to the cause. And it's a frustration I hear every single day. I don't think a day goes by in my life where I don't hear, well, listen, I've been diagnosed. And I oftentimes think to myself, you have a doctor who's an expert in this field. Why are they not telling you what to do about it? What they're doing is they're telling you that you have it, but they're not trained on treating the cause. They're trained on treating the symptoms. And it's not their fault. It's the system. The system doesn't work. And that's medicine. Medicine 101 is treat the symptoms, which I'm very happy with because if I have a severe injury, I want to treat the symptoms. If I have a headache, I want to get rid of my headache right away. But then I want to find out why I have the headache. The big question is always why. And that's what seems to be missing so often is no one ever gets to the why. And so that's what we're going to talk about today is with bone health, but I talk about that with every show. And again, as usual, if you have any healthcare questions, you could always send them to me through the website, yes? Reset? Okay, guys, hang on. Don't go anywhere. We're going to have to reset the whole system, so don't go anywhere. We're going to be right back.